Hi, welcome back to my A to Z video series on topics to do with pregnancy and perinatal mental health. Today I wanted to talk to you about the dreaded failure to progress. What does it actually mean? Usually it means something like your labour's slowed down, things are not moving the way we want them to, and it usually leads to we're going to have to use some sort of intervention to get this baby along. In the birth world, we tend to think of it as more like fear, tension, pain syndrome, because fear, tension, and pain are things that slow labour down. So, where does the fear come from? It comes way before we probably even get pregnant. It comes from things like listening to people's horror stories, those stories that are not the typical everyday birth but are the 1%. Things that go wrong. We sometimes confuse preparation with worry. A lot of people do that. This idea that if I research all the things that can go wrong and I listen to all the things that could go wrong, that will help me if something goes wrong on the day. That's not preparation, that's worry. Worry is a misuse of your imagination, and that's not helpful. Horror stories are also played out on TV and movies because normal, regular birth is pretty straightforward. Nothing exciting happens. There might not be lots of screaming and lots of, traumatic things happening. So if you're watching TV and movies where there's a pregnant woman giving birth, it's usually always dramatic because that's, potentially more entertaining to watch. I recommend you don't do this. I recommend that you watch positive birth stories and listen to positive birth stories so that you get yourself in a frame of mind thinking that actually birth is normal. It's been going on for however long you want to say it's been going on. And not every single birth is traumatic and terrible. So condition yourself to not be so fearful of things that are not that likely to happen. The other thing that happens, of course, is we get tense. We get tense before a labour, we get tense during our labour, and we don't necessarily plan on thinking about where that tension comes from. It can come from really minor adjustments in your birth space, All mammals need a quiet, private, preferably a dark place to give birth. It needs to be uninterrupted and we need to be relaxed in order to concentrate on the task at hand. There are small things about your birth space that can break your concentration and make you feel fearful and make you tense up. So things like having too much light in the room, having somebody that you don't know suddenly come into the room. We can't always know really deeply the people that we meet on the day of our birth, particularly in a hospital setting. But I guess, if you think about it, if you were taking your child to childcare for the first time, or maybe taking your dog to doggy playgroup, would you go and turn up on the day without checking the facilities and meeting the people? I mean, you'd maybe hopefully meet somebody there that you like, that you connect with, but there's maybe no guarantee that that person is going to be there every day. And yet, often when we go into labour and we go into the hospital, there's all these people there that we don't know, that we don't have any relationship with. And then we're supposed to enter this really vulnerable, primal state and hope that we are relaxed enough and do what needs to be done. So, the idea of keeping out people in your room who don't need to be there is something to think about, because every new person that comes in has a different energy, a different voice, and it can just break your concentration. And every time your concentration is broken, sometimes you have to just start again. So that's worth thinking about. The other thing that makes people fearful and makes them tense up is having some sort of time limit on your birth. There's no standard practice for how long a birth should take. It can be hours, it could be days, it could be any amount of time. But as soon as you are given cues like, time's getting on, or you look at a clock, or you hear details, or you start to notice things like maybe it's the end of somebody's shift and they want to go home, that puts pressure on you, pressure that you maybe can't, live up to, or nor should you have to live up to. So birth needs to be what it is, and it takes however long it takes. And it shouldn't be about you inconveniencing people because they want to go home, or because they'd like to speed things up because it's convenient for them. So long as mum is happy, so long as bub is happy, there's no reason to speed labour up. It just takes however long it takes. And that's best for mum and for bub. So some things to think about when you're preparing as well is that, You know, your uterus is a complex set of muscles. When we get tense, our muscles close up. They need oxygen, and when you're stressed, oxygen doesn't necessarily go and flow freely to the places that it needs to go. So, think about focusing on your breath, as well as, blocking out distractions, having people who don't need to be there, keeping the room nice and dark, because the best birthing hormones are the ones that are released when it's dark. If you think about animals, they go and find a nice, dark, quiet place. They're not looking for somewhere that's lit fully with lots of bright lights. Just small things like this can make such a difference. And of course, the other thing is think about doing a course, a childbirth education course that doesn't just focus on the medical. The medical side of things can be really scary for a lot of us, You might have a huge big epidural needle held up and see all the tubes and wires and think, ugh, this is what birth is about. Think about doing something that's more positive, that's still very evidence-based, that gives you lots of preparation to prepare your mind and your body for birth, like hypnobirthing. I run Hypnobirthing Australia courses every month. They help you to release fear. They help you to plan to reduce tension, to know what your rights are, to know what's the optimal birthing space for you. Please don't go into your birth thinking, I'll just wing it, I'll just see how I go on the day. Birth is like a marathon. It takes preparation. And the way to reduce fear and this sense of failure, like you've somehow failed, is to prepare. All right, I'll talk to you next time. Bye.